Hello everyone, this is Craig Merriweather and this is part 2 of the 4 real causes of depression, and we're just going to go right into it. The first one I wanted to start off with is your physiology. Now when the body is dealing with an illness or an injury, it might compromise the immune system. And as I talked about in part 1, your mind is trying to get your attention in some way, and it often does that through either pain in the body or depression or anger or some other symptom. It's like a check engine light, and it's trying to get your attention that you need to focus on a situation, focus on a problem that the body is having. And it'll often do that with depression by sending the signal through your body that you're feeling depressed. Now I don't mean that when you go to the doctor and you get the bad news that you're dealing with a really serious illness that you feel sad. I mean, you probably do. What I'm talking about is that as a function of that illness, the body will create depression as a side effect. This will happen, can happen, not all the time, but can happen with arthritis, with cancer, with diabetes, with heart disease. And it's just the body's way of trying to get your attention, which is kind of frustrating at times because you know you're sick. But one of the side effects of that illness could be depression. Another one is hypothyroidism. When your thyroid stops or decreases its production of hormones, it mimics depression to a T. It looks exactly like depression. It's very hard to tell one from the other. And as you get older, you might start having some problems with your thyroid. If you've done a lot of yo-yo dieting, you could have some problems with your thyroid. So that's something you need to go to a doctor, you need to get blood tests and see how well your thyroid is working. Another one, nutritional deficiencies. If you are deficient in omega-3 fatty acids, if you're deficient in vitamin B1, vitamin B6, vitamin B12, vitamin C, vitamin E, vitamin D, we're going to go into vitamin D in a bit later. Any deficiency in one of these nutrients, and there are others as well, can show up as depression in your body. Another one, this is an amazing one, food allergies. So when you have a food allergy, nutrients aren't getting into your brain. If your brain's not getting the right nutrients, again, it could show up as depression. And they did a study where they wanted to see if they could get mental symptoms out of foods. And so they had a group on placebos, and they had a group that they were seeing which kind of foods might cause some sort of mental reaction, either fogginess of the brain or anger or confusion or depression. And they couldn't get that effect with any of the placebo patients. But they could get it from people eating various kinds of foods. And the 4 foods that came up as that gave the most amount of mental symptoms were milk, wheat, sugar, and eggs. In other words, that's breakfast. So these are foods we eat all the time. Those are the top 4, and there are others that you may be ingesting that could be causing your depression. They did another study where they broke groups up into one group was struggling with depression, another group was struggling with alcoholism, and the third group was dealing with schizophrenia, and then they had the control group who weren't dealing with any sort of emotional or mental symptoms. And what they found is that people who were struggling with depression had the most allergies to food. And 80% were allergic to barley, and 100% of the depressed patients were allergic to egg white. Fascinating stuff. The control group, only 9% of the control group was allergic to anything. So this is something that, again, you could go to a doctor and you could get those food allergy tests. A third study found that 70% of the people they were looking at in their depression study, 70% of the depressed people in this study had some sort of food allergies. So something you also need to go to a doctor and get that checked out. Food additives. There's so much stuff in our foods nowadays. we all eat a lot of processed foods, and you're going to have to start looking at labels and seeing what's in there. Glutamic acid and monosodium glutamate and aspartame. These are all neurotoxins, and they can affect your brain and your thinking if you start ingesting this stuff and ingesting it in large doses. One of the chief complaints that the FDA gets about aspartame is that it causes depression. So again, this is one of the things you're going to have to start looking at what you're eating, looking at the ingredients, and start reading labels. Here's a big one: head injury. If you've suffered a fall, if you've been in a car accident, if you've kind of whacked your head in any sort of way, your brain has a consistency of soft tofu or maybe butter. And you have these bony ridges on the inside of your skull. So if your brain gets jostled around, it could cause a concussion, could swelling of the brain, maybe make little tears in your brain. You might start bleeding in your brain. And one of the symptoms of a head injury is depression, but it might not happen for a while. So there was a study in the Journal of the American Medical Association, and they found that in the year after a traumatic brain injury, roughly half of the survivors will likely experience a bout of clinical depression. And it's very difficult to trace that back to your accident. Even if it's a mild trauma to the brain, you can still find links to depression up to 2 years afterwards. So if you're here today, why would you think a year and a half ago, the accident you had, why would you think that would be related to your depression? It's very hard to kind of link those two things together. Again, that's something that you might need to see a doctor about. Dr. Daniel Amen, who I mentioned before in part 1, he has these Amen clinics which actually look at a brain scan called SPECT, and they can see where blood is flowing to the brain and where it is not, and do a lot of great brain diagnosis through that. Maybe you've been reading the papers about the situation in the National Football League and how a lot of the players are struggling with degenerative brain diseases. And maybe you've been reading the paper that some of these guys are committing suicide. And maybe you've been reading in the paper that some of these guys are shooting themselves in the chest instead of the head so that their brains can be studied later on. Dr. Daniel Amen is actually working with the NFL and is having incredible results on using his techniques and for regenerating a healthy brain. So it is possible, but whether it, a skiing accident or a snowboard accident, or fell off a skateboard or a horse or a bicycle or anything that might have jostled a brain could potentially cause depression. So something to maybe go back into the last few years, last 3, 4, 5 years, and just think, have you ever had an accident where maybe you suffered a concussion or whacked your head hard enough that maybe might be linked to depression? The last one I want to talk about is low testosterone. And they did a study where they looked at men and who had low testosterone. They were 241% more likely to have depression than a man with regular or high levels of testosterone. So as we grow older, we start losing testosterone. So a man in his 50s has lost 25% of the testosterone he had in his 20s. A man who is in his 70s has lost quite possibly 50% of the testosterone he had when he was a young man. So again, this is something that you would need to go to a doctor for and get tested. And ladies, your bodies also produce testosterone. Of course, not in the same manner and in the same amounts that men do, but low levels of testosterone in a woman's body have been linked to depression. So something to take note of. And again, these are things that can all be fixed. All these things can be fixed. Good thing to do is just go to a doctor and maybe get a healthy checkup. Do blood tests. Look for, see if you find any vitamin deficiencies or food allergies, or go through your life, see if you had a head injury. So that's all for this one. I'll see you in part 3.